Hello and welcome to Dragon Bytes, the pediatric podcast aimed at pediatric trainees or anyone interested in child health. I'm Asim, one of the pediatric trainees here in Wales, and one week we've got another one of our careers episodes, all about applying to the Renal Grid programme. Rebecca Jones, one of our newest Dragon Bytes hosts, is joined by Dr Ash Gutpa, consultant paediatric nephrologist at Birmingham Children's Hospital, and by Shouja Alam, also based at the Birmingham Children's Hospital. In this episode, they discuss the application process to get onto the Nephrology Grid programme.
Welcome to Dragon Bytes. Welcome to Dragon Bytes. Today we're talking all things Nephrology Grid, and we're joined by two special guests from over the bridge. You've got myself, Rebecca Jones, and Asim Javed as your hosts for today, and our guests are Ash Gupta, a renal consultant from Birmingham Children's Hospital, and Shouja Alam, who is a Welsh trainee who is doing his grid training in Birmingham Children's Hospital. Can we just start by both?
For the introduction already, Reb. Yes, so I am a Wales trainee actually, and I, after studying medicine at medical school in Bristol, I went straight back to Wales where I grew up, and I was there since foundation school. Wales, of course, doesn't offer foundation school. Wales, of course, doesn't offer grid training opportunities for pediatric nephrology, as it's not a transplant centre itself. And so I had to spread my wings and search further afield for training opportunities for the field that I need to Birmingham Children's Hospital. So I ventured all the way over the bridge to England and have been there since over the last year.
Excellent.
I'm Ash Gupta. As you said, I'm a consultant paediatric nephrologist at Birmingham Children's. I completed my medical school in Nottingham and did my foundation jobs there. And the start of my paediatric training as well, I moved across to Severn, to Bristol as well for a year of my early reg training before I applied for grid in ST5. And then I moved across to the West Midlands and I stayed there for grid training and stayed there for my consultant jobs.
So both of you have travelled around a bit as part of your training. So that's really good to know that it's something that's a option. What was it that drew you both to, if we start with you, Ash, what was it that drew you to pediatrics and then on to renal?
So I think pediatrics is, I applied for a different specialty, and just in the months that the applications went in, I did, and it completely changed my perspective on things. And I just found pediatric nephrology hugely exciting. It was the first time I was able to apply physiology and basic science directly to clinical practice, and we could see things like a tissue on a renal biopsy and then change our management plan based on that. And I found that really exciting at the time. I really also loved working in teams and working in pediatrics in general, especially in pediatric nephrology. You work in MDT really closely, and then you've got lots of colleagues within the UK that you work closely with and internationally. So I just loved the team atmosphere. And then I didn't realise, specifically with pediatric nephrology, was that you look after patients on an acute basis. If they're immediately unwell, you look after them. And usually pediatrics and children bounce back really quickly. And that was huge. Children have long-term problems, and you look after them from a baby all the way up to when they become adults, and you transfer them to adults. And I just got huge satisfaction from working with children and families over a longer period of time, and getting to know their families. So I think I really liked pediatric nephrology, and so I think I was really keen on it just at the time of applying for pediatrics. But I tried all the other specialties before I applied for Grid, and just nephrology just stuck with me.
Before I ask the same of you, Shouja, I guess what you said at the end there, Ash, that asking what you think the most rewarding part of doing your job as a paediatric nephrologist is.
Yeah, I think all of those three things really I just value so much. It's really good to be able to know that you have so much variety in your role, so much variety in your role. You've got everything is challenging in a nice way, and you've always got a good supportive team, from all members of the multidisciplinary team through to other consultant pediatric nephrologists, across the world really, to support you to do that. And I just find that incredible that you can work at that level and have that level of support to deliver such high quality care. I didn't ever think that I'd have the opportunity to work in that kind of setting. So that's what I find hugely rewarding.
You're inspiring us all now, Ash, and it's only the start of the podcast.
I hope so.
We have to talk a bit more about the technical details of applying for Grid and what sort of things doing nephrology will involve as a Grid trainee. So I was wondering if you guys would be able to tell us a bit about what the actual training program involves and how long the start to finish process is.
Yeah, sure. I can start to tell us a little bit more about the structure of the program, because he's entered at the point of a change in the curriculum. So in terms of the actual program, it varies according to which centre you're in and whether you decide to do a clinical program or whether you decide to do research. So the Grid program itself is 2 to 3 years, and each training centre will specify how many years you would normally train for. And then you have the opportunity to take up research during that time as well, and that would lengthen the training. Shouja, since the progress curriculums come in, your requirements are slightly different, aren't they?
Yeah, actually, I think they've made it a lot more generic and straightforward. Actually, in order for you to evidence your progress, but it is still essentially the same core areas that you need to get experience in. One of them, for example, is dealing with kidney transplant, which we've already talked about. For that reason, the training needs to be in a transplant center. And there is one training center currently doesn't involve transplantation. That's at Southampton in Wessex. But then they are linked with a transplant center in London, usually Evelina, I believe, where the trainees would usually spend at least one year in London as well to supplement their learning. So there are core domains within the subspecialty curriculum, which would include transplantation and then dealing with renal replacement therapy, such as peritoneal dialysis and hemodialysis and hemofiltration. And then dealing with acute kidney injury and chronic kidney disease, and electrolytes, and then also congenital abnormalities and dealing with and being able to interpret kind of radiographical investigations, and finally dealing with the patients as a whole person. And there are some specific points in the curriculum about transition and working with the multidisciplinary team, which Ash has already alluded to is such an important part of nephrology. There is also specific outcomes about biopsy, which is one of the main practical procedures that we have in pediatric nephrology. And, throughout, to gain the expertise in all of these fields that we mentioned, you will have exposure on the wards, running the acute service. You will have experience consulting for patients that are in intensive care or calling for telephone advice. And you would also get experience by kind of managing patients on an outpatient basis. So there would be, regular clinics that are dealing with patients with kind of chronic kidney disease, and different specialty clinics for example, Ash has a specialist interest in genetics. So she has clinics that run specifically in that, and for conditions for example, Bardet-Biedl syndrome. And other nephrologists will have their own specialty clinics as well. And hemodialysis itself runs kind of like an outpatient department. So through all of these different kind of experiences, you will be able to evidence having kind of dealt with and built up experience with each of these conditions. Us as pediatric nephrology grid trainees, we do have a dual curriculum to have to evidence against. So we still have the e-portfolio as you usually would, and we would still have to maintain our progress through the progress curriculum for general pediatrics as well. That's very important. Through the progress curriculum for general pediatrics as well. That's very important, that we actually end up dual accredited, dual qualified with our CCT at the end. And it's important that as you are going through your nephrology competences, that you don't let your general side suffer. And certainly, in the training places attached, Birmingham Children's Hospital is an excellent example of this. There will be plenty of opportunity to gain your general pediatrics during your on-call shifts. And you would literally have to find the time and be organized to make sure you keep your portfolio up to date and used to make sure you keep your portfolio up to date and use the cases that you see to link to your to both of these curriculi. Curriculi, is that the plural of curriculum? Curriculi?
Yeah, I'm not sure, but it can be now. When completing grid training,
usually you end up being placed in one or two tertiary paediatric nephrology centres, but there are other posts that can allow you to obtain the competencies, such as PICU, because you would, for example, you could be managing patients with acute kidney injury there, and those that are need to start filtration, for example. So historically, other sort of time or posts in other departments like PICU have contributed. But the conventional route is that you're placed in the tertiary paediatric nephrology centre and you work within nephrology for that period of time, whether it's 2 or 3 years. But there are exceptions to that as well.
Yeah, that's a really good question, Reb. I asked the CSAC, and she explains that the pediatric nephrology training, regardless of which center you're placed in, generally the rule is that actually that would take 2 years, full-time equivalent, 2 years. And then it depends on at which point you have entered, and then it depends on at which point you have entered your training. So if, like myself, you've entered at ST6, that means your CCT date is actually potentially after 3 years. So those 2 years could be taken up doing your pediatric nephrology of really what are you going to do in that 3rd year. And that is where you might find it supplementary to your training to do a placement in PICU, for example, or, for example, pediatric rheumatology, where you're dealing with kind of systemic vasculitides and using similar medication and immunosuppression, and using similar medication and immunosuppression, or metabolic medicine, which again are fields which have similarities to and work with pediatric nephrology. Or it might be that actually you need to supplement something from your general pediatric curriculum. So she told me that there are examples of so that's where there is some flexibility. But if you join the grid training at ST7, then it does mean that you have to achieve your competencies by the end of ST8, because there isn't actually leeway to extend that CCT date unless you did time out of program. So that might be for research, for example, for specific things, but you wouldn't otherwise generally be able to extend your CCT date.
Shuja, that's really clear actually, and I think that's really useful for people to know and understand. Um, the only thing is that some trainees also choose to go abroad, and they do that after their paediatric nephrology training. So some units have established links with other centres like the Sick Kids Hospital in Toronto, and so you have the opportunity to apply for fellowships there prior to taking up your consultant job in the UK, or a post CCT fellowship as well, where you obtain your CCT first and you go across there just to add to your experience and or research skills.
Oh, that's amazing. I think that'd be really useful. Oh, that's amazing. I think that'd be really useful for all trainees to know. I'm early in the process, but I certainly didn't know that those kinds of things were options. Okay. And I think we've already covered how specialised nephrology is, and that not all centres have access to as in-depth nephrology that you guys see at the children's. What sort of things can trainees do if they think they might be interested in doing nephrology to gain experience?
I think I think you can do lots of things. So within your sort of day-to-day job, if you do things as Shuja suggested in the past, is if in the previous questions rather, if you see a patient with any renal problems, if you to do a work-based assessment or to reflect on your portfolio, it just shows your enthusiasm and dedication for the subspecialty. You can also consider going to clinics where some of the paediatric nephrologists that work in tertiary centres will come out to smaller centres to do clinics, the peripheral renal clinics, jointly with general paediatricians in that centre. So you can always attend those clinics, ask to attend them. You can use your taster days to spend time in a paediatric nephrology centre. You can request a paediatric nephrology post, and talk to your training program director and see if they can do that for you. And then other things that you can do, and this would be outside of your day-to-day job, would be attend nephrology meetings. So you could physically attend them. I know currently with the COVID era, we're doing everything through video teleconferencing, but you can always ask permission to attend nephrology departmental meetings, attend tertiary clinics through that. And outside of that, I don't know if Shuja wants to add kind of outside of the work environment. What did you do, Shuja, to show your interest and gain more experience? Did you do anything else?
Yeah, so I think you summarized really well, Ash, like kind of the steps that you need to take once you've got an inkling that you might be interested in a particular field. And really, for anyone who's this, I do have to reiterate that, it's not like you ever know 100% for sure that this is the specialty that you absolutely definitely want to do right from the very beginning. It does take kind of just following your own hints, your own interests, suspicions, your thoughts, and then don't be afraid to follow them through and doing those things that Ash has suggested, because it's only really at the point of doing quite a lot of those things that you might make up your decision. And I certainly explored a few other specialties before deciding on nephrology, and I went through that process. In fact, I even got trained up to do endoscopies, and I was very close to applying to gastroenterology. But when I finally did my nephrology job and got more experience doing projects, that's when actually I weighed the two. No, I'm going to go all in for nephrology. So, by all means, if you are a listener to this and you feel like you just don't know necessarily exactly what you want to do, but you have some ideas, that's great. That's more than enough to begin with, and then just jump on that and see where it leads you. And we time as well. So to answer Ash's question specifically, what else did I do to kind of show my interest when I knew that nephrology was something that I was interested in? And partly, guys, I would say, and I'm going to name drop here, it comes down to the individuals you work with. So, I mean, one of the individuals I worked with was Judith Vandervoort, right from the very beginning of my training. And she is one of the most inspiring pediatricians that you will find, and an incredible educator. But at the same time, she's a pediatric nephrologist and just brilliant to what she does, and really watching her work and being watching her work and being attached to her for so many years as my supervisor really prompted me. So don't be afraid to follow those few little subjective biases that make you feel like actually this might be the thing for me. Through Judith, I did actually, and I would highly recommend trying to get on board with a supportive supervisor to try and get involved in some projects that will go the distance. So what you're trying to do with your project is see it to completion, A. B, project is see it to completion, A. B, to try and get it presented, and ideally presented at least regionally, if not nationally. That's what you want to aim for, if not internationally. And finally, to get things published. And, when a supervisor like these that you are keen and interested, it doesn't matter what level you're at, they will take you on board. And if you've got some ideas, they will help to support you to get through, to completion. And that's what helped me. During my training, I took an academic year out as ST3. It wasn't a academic year out as ST3. It wasn't a year out. It was an incorporated academic year into my training. And one of the projects I did was a multi-center nephrology-related project, which we ended up presenting at a European conference up in Glasgow. And that really helped me. And me as first author, kind of critiquing some again some trials that were being done internationally, and that's what I would say. Even if you don't have a project to an original article to publish yourself, you can always try and write papers like I did. So I published a paper as first author for evidence-based medicine in the BMJ, which was essentially like a journal critique of a nephrology study, and that also counts. And this really does show that you're interested. You're showing commitment to the specialty. And one more thing that I did, to the specialty, and one more thing that I did, I tried to. One of my projects, QI projects, was related to the transition of young people into from pediatrics to adult services. So I tailored that to the nephrology setting, and I attended a renal youth camp, and I performed some service improvement stuff at this camp with these young people. But if you can volunteer and actually show that you're doing something related to your specialty in that regard, I think it goes leaps and bounds, especially when you're coming to writing stuff for your application. Especially when you're coming to writing stuff for your application and having things to say at interview.
That's brilliant, Shouja. That's exactly the kind of thing that we would look for in a trainee. I think the other outside, the things that you can do outside of your day-to-day job are you could always trainees to see if you can attend one of their training days. The grid trainees across the UK are hugely supportive. The trainee lead, the name of the trainee lead is on the RCPCH website, and their email address is on there, and you can contact them directly. They'll invite you to the training days. You'll have the They'll invite you to the training days. You'll have the opportunity to listen to the talks, which is educational, but also to network with other nephrologists and with the other trainees. And through that, you can you'll know which are the good courses for you to go on if you want to go on them. And one upwards, actually medical school upwards, to come to is the BAPN meeting. That's the British Association of Paediatric Nephrology. We have an annual meeting in the winter. Usually it's in December, between December and February, and it's one of the meetings where we frequently get individuals who are keen on paediatric nephrology, and they present their projects there. And I'd encourage everybody to come to that.
I I completely agree with Ash on that, actually, and definitely about the grid study days and the BAPM meetings. Absolutely, were really helpful for me. Equip, and that's dealing with kind of nationally led, nationally run quality improvement projects within the specialty of nephrology. And they had their own meeting, which I attended at this stage whilst preparing for my grid application. And it was really useful to kind of present for my grid application. And it was really useful to kind of present some of my quality improvement work but B, to find out what's going on nationally at the on the radar. And then these are really good things to be aware of and to be able to kind of name drop that into your coming application and interviews.
You guys have provided us with so much food for thought in all of this. I think lots of people are not going to realise all these little things exist. Is there anything specific that trainees need to do to sort of, have you got any bits of advice for that sort of aspect of it?
I'll start with this one, if that's okay. I think that the key thing to do at the very beginning is, well, first of all, start in advance. Think about your application form in advance. Well before the date of it opening up, because actually the application form tends not to change year to year. So you'll put yourself in good stead by actually having a look at last year's questions and trying to think in how you would populate your answers. And secondly, before you even start to brainstorm, is look at the shortlisting criteria. That's freely available on the RCPCH website. If you type in subspecialty grid training, or the grid application it's got all the information there that will help. And the main thing to look at is the shortlisting criteria, and what you want to aim to do is to achieve the maximum points for each of the subject areas for the application job description, and that will also highlight the kind of preferred characteristics that they're looking for. And you want to try and really achieve the maximum points on the shortlisting criteria, and make sure you sell that you are the kind of person with the kind of characteristics that they find desirable. And so, to answer specifically, your question about how to really help to make sure that you get enough points to get to interview, I would just highlight some points. So, for example, when it comes to teaching, all of us get involved in teaching, but for the maximum points, you're looking to design and lead some kind of teaching program. So if you think about what's available in your own particular deaneries, in your own educational contexts, what can you get involved in that's going to help you to design and lead a specific program? I had my own examples, but what are yours going to be? And then attached to teaching is some kind of formal teaching qualification. You may have noticed that they got rid of points for having a separate degree. In preparation for this, I did look at the published shortlisting criteria. So I think they used to give 2 points for a degree. I think now there is still a single point that is available, but it doesn't give you anything extra for having a degree in medical education. But you can still get that point by doing general instruction course, like you might have for being nominated for an APLS instructor, or trying to do some kind of a postgraduate course that maybe your postgraduate medical education department may run some kind of a teach the teachers training session. So have a little look at what your own dean. Then there are things like publishing. So they do want to see you publish if you can. And the maximum points will be if you can publish as first author in at least 2 papers. That would give you the maximum points. You will still get points for other kinds of publications, but for the maximum, you want to be the first author, and they need to be two separate publications, excluding case reports. They want your research to have been kind of presented on the national stage for the maximum points, and they would like your leadership, kind of whatever kind of leadership or management stuff you've done. Again, for the maximum points, they want that to be a national or at least regional. And I guess the last thing I was going to say was about quality improvement, that they just want to see you having, completed cycles, design-led, presented, and have evidence of having done things regularly through your training. So, I mean, the answers are all there in the shortlisting criteria as to what to try and achieve. But then what you've got to do is look at what you've got, brainstorm everything that you have, and see where and how you can word your experience to that you have met that criterion for the maximum marks. Where of course applicable, you can't lie, of course, and you can't twist something that's not there. But if you've got it, or if you can tweak what you've got by doing a simple kind of presentation somewhere, and getting an abstract in, then that is the way to really make your application stand out with the maximum marks and improve your chance of getting that interview.
I think that's really comprehensive, Shouja. I think Shouja's covered all the main bits, I think. The only thing I would add is that remember that the points are not specifically nephrology, don't have to be nephrology related. So everything is transferable. So transferable skills. You just have to show that you're able to follow a project all the way through, for example, or have been involved in, I don't know, teamwork, etc. Whatever it is, whatever point you want to make, it doesn't have to be that you were working in pediatric nephrology or that it was nephrology related. There is a section on commitment to nephrology, and you can show why your commitment and things in that area. But otherwise, don't be afraid you achieved in other specialties. And also remember that you don't need to get maximum points to get an interview. There's a threshold you have to cross, and each year that threshold will change. And you just have to get enough points to cross the threshold. You don't need to worry if you don't get maximum points for things. You just try your best and you go for it. And like Shouja said, usually all of us as doctors aren't very good at blowing our own trumpets, and we're not very good at selling ourselves. And often your supervisor, or sometimes your best friend, or sometimes anybody outside of the current situation that you're in will be able to see your achievements a lot better than you. And I would make sure that you get your application form checked by as many people as possible across different specialties. They don't even need to be a medic, I don't think, to look at your application for you, to make sure that you're selling yourself properly and you've got all the appropriate points in there.
That's amazing. Thank you, guys. That was really good information to give trainees for their application.
Joining us for these podcasts, and to Rebecca for hosting them for us. As you probably noticed, Rebecca introduced me at the start of that podcast, but she did such a great job that I wasn't really needed to say anything during it. Join us again in a couple of weeks' time, where we'll be releasing the second part of this podcast that discusses how to interview for the Nephrology Grid programme. Thank you for listening to Dragon Bytes.